Good afternoon, everyone. Thank you for joining our weekly classes for the Family Caregiver Support Program here at St. Barnabas. This meeting is being recorded and will be posted to our St. Barnabas website. You can have access to that. Today's topic will be, I will be discussing long-term care and just a few details on what it entails. My name is Olga Imawaki. I am the case manager, one of the case managers for the Family Caregiver Support Program at St. Barnabas. I would like to introduce to you our team at the Family Caregiver Support Program. Amy Blackburn, program manager, and Michelle Mawire, another case manager for the program. So what is long-term care? Long-term care is a variety of services to meet a person's health or personal care needs. This type of services help the individual live independently and safely in their home, which is the primary focus for most older adults and their families. It is some care is for short-term purposes. This could be for someone who is recovering from an operation after a hospital discharge. It can also be long-term for other individuals who need more help on with their personal care and daily activities. Long-term care can be provided in different settings, whether it's in the home or out in the community, and I'll go a little more details into the different settings. It can also be provided by different individuals, such as family, friends, and again, I'll go into details on that part of long-term care as well. So long-term care can be a serious ongoing, when a person has serious ongoing health conditions or a disability. It can also occur suddenly if somebody falls and requires an injury, broken bone, or it could also be through surgery if they need surgery or if they have a car accident. Also, if an individual suffers from a heart attack or stroke, that's something that you don't see it coming. Care can be provided at home for most individuals. Also, some of long-term care, usually if it doesn't happen suddenly, most often, however, it can develop gradually as the older adult ages and they become older and frailer, or if they have an illness that gets worse with time, requiring more care at home. This care can be provided it's usually provided by non-paid family caregivers in the home, and or also some friends. There's some older adults that don't have any family around, so their friends or neighbors tend to provide some of that care. Some of the care can be provided in facilities, such as nursing homes, and I'll go more into details later on in the presentation as to what those facilities are composed of. Long-term care can also be provided within the community. There's community centers where older adults can go in and get some of that care that they might need to help them live longer at home and within their community as well. The most common type of long-term care it tends to be more of a personal care as opposed to health care, meaning an illness. Some of this help is with entitles to everyday activities for older adults. This is eating, bathing, dressing themselves, Some of them require more of grocery shopping. They can do house cleaning, medication management, finances. A lot of this types of care that older adults start to having needing more help with. Some of the services that older adults may receive through community services are meals and transportation, which is, they also can provide entertainment and activities for older adults. Community services tend to be, it could be free for some of them, but there is some minimal charges, which is composed of sometimes just a simple donation to keep those activities going in the community. So who needs long-term care? It's difficult to predict who's going to be needing long-term care and how much care or what type of care the individual will be needing in the future. But there are several things that increase the risk for individuals needing long-term care. One of those is age. As we know, as we get older, we tend to, our chances tend to increase more of needing long-term care. If you have an illness, those chances are going to be increasing as well. Gender. Women are at higher risk than men needing long-term care. And that's primarily because women tend to live longer than men. Marital status. Single people are more likely than married people to need care from a paid caregiver. It's not that if you're married, you're not going to need long-term care. It's just that you have a spouse that's going to assist you with, as opposed to somebody that's single who's still going to need that, maybe that same care. It's just going to be paid as opposed to having somebody there who is an informal caregiver, such as a spouse. Also, your lifestyle choices, a poor diet and exercise habits, it can increase the person's risk of needing long-term care. Your health and family history, if you have a family history of illnesses, that might increase your risk of needing long-term care in the future. How much care will you need? Someone age 65 has almost a 70% chance of needing more, or at least some type of long-term care services in their life. Women, like I mentioned, need more care than men, 3.7 more years they outlive than men. At least 1/3 of today's 65-year-olds may never need long-term care, and 20% will need it for longer than 5 years. That's 20% of older adults, 65 and older. This is a little graph that I found interesting. It says it shows that overall more people are receiving long-term care in the home than in facilities. If you see here, 69% of all older adults will receive at least any type of service for an average of 3 years. Unpaid care, that's through family caregivers, at least 59% of individuals will require at least 1 year of care by a family member. And then 65% of older adults will receive any care at home for at least 2 years, which is, as opposed to facilities, only 35% of individuals will require at least 1 year in nursing facility care. And I think this also has to do with the affordability of in-home care as opposed to actually receiving care at a facility. Who will provide long-term care? Long-term care is usually provided, again, by family members or friends. Usually family members are unpaid caregivers. You also have your paid caregivers who you can pay through either an agency or an informal caregivers, somebody that you know, that you pay them to provide services for your loved one. Healthcare professionals, usually these are services that are medical services that are ordered by your physician. It could be for a specific condition, health condition, or if an individual is recovering from like surgery again or an accident, they might require some more health care services through a nurse. Therapists also can come into the home, whether it's in the home or you're at a facility, and provide some of those services. Adult day services, that's a service that you can get through your local community at centers. Adult day services also provide different services depending on what type of services you might be needing, such as, again, meals, transportation, and activities, and as well as some of medicine, more of a, they tend to have nurses on staff as well, so they'll kind of check some of the medical, but not as detailed as a doctor would. There's also friendly visitor and senior companion services. These are usually through also local organizations, community organizations that might be offering those type of services for families to help the individuals in the home. With this current situation of COVID-19, a lot of these organizations are not providing the friendly visitor companion services at this time. So it's been a little difficult for some seniors as well as the organizations and the families trying to get these services implemented in with this current situation. And long-term care could also be provided in care facilities, long-term care facilities. A little bit of caregiver facts. 80% of care at home is provided by an unpaid caregiver, which usually tends to be the family, whether it's a spouse, a daughter, niece, nephew. Caregivers spend an average of 20 hours per week providing that care to the individual. 58% have intensive caregiving responsibilities. This not including the daily activities that the individual might need. Some of this intense caregiving responsibilities includes medical assistance, which some of the caregivers are not properly trained on. We've had clients who do fitting tubes, who change their husband's dialysis, things like that that are being provided at home by the family. 2/3 of caregivers are women. 14% who care for an older adult are themselves age 65 and older. Most people can live at home for many years with help from unpaid family. Yes, with help from an unpaid family member or friends, which is what most individuals want. There's also respite care. This is provided mostly for the family caregiver to give them a short break from their caregiver responsibilities. It could be for, an afternoon, 4 hours, or several days in case there's more work, more help that needs to be done if the caregiver needs to be away for a couple of days. But this is, it's tend to be short-term. It's not for a long-term care. Is just to provide, like I said, to provide just some rest and relief for the caregiver to take a break from his or her duties. Respite can be provided in the home or in the community. It could be provided by friends, volunteers, or trained staff from agencies. If you are hiring somebody from an agency, they usually charge by the hour, and there's tends to be a minimum of 4 hours that they require for somebody to come out to the home. Most insurance do not cover respite costs. Caregivers can also find respite through local agencies. Our program, the Family Caregiver Support Program, offers respite. That's also, depending on the funding of the program as well, and the need of the caregiver as well as to how many hours they can receive respite for. But again, this is all just short term and just to provide a brief break from the caregiving duties and responsibilities. So long-term, I want to go into some long-term care facilities. These are licensed residential care facilities for the elderly. They're composed of different settings such as board and care homes, assisted living, nursing homes, and the continuing care retirement communities. And I'll go a little bit into some details, not too much details into what each of them compose of and the services they offer. So board and care homes, these are more small private facilities. These are, and usually when someone goes into a home, that's because at some point the family can no longer support the services being provided in the home. So they find that they have to move in their loved ones into some sort of facility depending on the care that they might be needing. So board care homes are small private facilities. They're usually composed of 20 or fewer residents. The rooms may be private or shared. They can provide personal care and meals. They usually have staff around the clock. So there's always somebody there 24/7 to provide any help that might be needed. Nursing and medical care are usually not provided on site though. So any individuals needing more of a medical care will not be put into a board or care home. Assisted living, these are for individuals who need a little more help with their daily care. The facilities range in size. It could be from 25 to 120 or more residents. They have private apartments or rooms. They do share common areas such as the dining room and the activities setting. They do offer many services, meals up to 3 times a day. They have personal care, help with medications, housekeeping. They also do social and recreational activities. And then we have nursing homes. These are also called or are known as skilled nursing facilities. These are more health related. An individual might need more, when an individual needs more health related care, usually they go to a skilled nursing facility. Their focus is on medical care. If an individual has surgery and needs to be discharged, instead of being discharged into the home, they'll get sent and discharged into the skilled nursing facility. They offer rehab services such as physical, occupational, and speech. If somebody falls and has surgery, they need to rehab the leg or the arm. This is where they'll be receiving these services. It is short term for those who are receiving therapy, and after once they're recuperate, then they get discharged into their home. Some individuals though do live in skilled nursing permanently. They might be, and it's because they might need more ongoing, they have more ongoing physical conditions that require constant medical care and supervision, and they can't be discharged into the home. So they tend to stay there longer periods of time. And continuing care resident communities. These are retirement homes. A lot of people know them as retirement homes. These are different levels. They offer different levels of services in one location. So an individual might start in the independent housing. You're independent, you can take care of yourself. But if any issue arises and you start needing a little more help with your daily activities, then you might they might move, or you might decide to move into the assisted living part of the community to receive those that help. There's also, you might still live in the independent housing and have somebody come and help you with those needs as you might need them. And as you know, more issues, health issues arise, or if you suffer a fall and need more of a medical assistance, then you might move into the skilled nursing facility that offers more healthcare services. So it's everything's there. It's just depending on the level of care, you kind of start to move down the ladder, as I would put it, to receive those services that you might need at a certain time of your life. And then they all offer recreational programs as well. I think that's it for that. So some of the average cost of residential communities for older adults. This is national averages. The prices range depending on the state and your area where you live. For assisted living and memory care, assisted living starts at $4,000. I mean, it's an average, $4,000 monthly. It's an additional 20 to 30% more if your loved one needs a memory care unit, such as if they're suffering from Alzheimer's. For nursing homes, a shared room could be anywhere from $7,400. A private room, it starts at $8,365. So again, depending on the state and where you live locally. CCRCs, those are more expensive. This is a one-time, they require a one-time entrance fee, and it could range anywhere from $80,000 to $750,000. Plus, you also have a maintenance fee that you have to pay every month to live there. And again, depending on your needs and care, the price can range significantly. And this is a little more breakdown. It also states home health care aides. That's something that you would pay in the home. Average starts at $21 an hour if you're having someone come into the home. Home health aides, that's more of a medical need, somebody that has a nursing degree that can come into the home. That average cost is $22 an hour. And again, that's depending on the agency that you contract and the area where you live. Adult Day Center, that's something, that's a community program. You still have to pay, but it's still not as, in the long run, it's not as costly as paying for either a home or somebody in the home, which is $72 per day. Again, depending on the needs the individual is requiring, and the family too, the family needs. So paying for long-term care, you know, depending on everybody's situation is different, and everybody's needs are going to be different. Personal funds, a lot of older adults and family caregivers pay out-of-pocket expenses for their loved ones' care. This could be their personal savings, pension, or other retirement funds. There's also government health insurance programs, which I'm not going to go into detail about that because it's very complicated and I'm not an expert on that. Many older adults though may be eligible for some government healthcare benefits, but again, benefits are different from state to state, and the eligibility for individuals, it's differently as well, depending on their circumstances and situations. I know Medicare pays for some skilled nursing facility, but it's for a short term. I think they only pay 100 days in skilled nursing. And then after that, it's either you get discharged to your home or you pay out of pocket. Medicaid might pay for some long-term care, but again, you have to qualify. There's some eligibility requirements that the individual must meet to get those services. There's private financing options, such as long-term care insurance. And again, that coverage may depend on the type of policy that you purchase or the services that are covered under that policy. There's reverse mortgages if the individual owns their home, life insurance policies, and trusts that you might, tap into it to pay for long-term care. There's veteran benefits for veterans as well. The VA may provide some long-term care or at-home care for some veterans. I know there's sometimes there tends to be a waiting list for some of those services for veterans to have access with. So it's always good to check with your local VA and see what services are available for veterans. And whether it's public programs or private sources of payment, they all have their own rules, eligibility requirements, co-payments, and premiums for services that they cover. So just if you're planning on buying something for yourself or a loved one, just do your research and see what it is covered, what it covers and what it doesn't. Because whatever it doesn't, you're gonna end up paying out of pocket in the long term. But it's always, good to plan ahead. And we might think we might not need long-term care, but you never know. Okay, that is all for my presentation. Any questions or comments or anything you'd like to add?
Yeah, I just want to say that the Veterans Benefits Program is actually a really good one. It's called VA Aid and Attendance. So pretty much most veterans who had boots on the ground are eligible, and VA Aid and Attendance pays anywhere from, I think it's $1,200 to $1,500 for the veteran, but also for the veteran's spouse, even if the veteran passed away. So that's huge. The spousal benefits are a little lower. I think that's the one that's more in the $1,200 range. But yeah, it'll cover either assisted living or an in-home caregiver. So that's huge. I know a lot of people who have used that and benefited from it. And the veterans paperwork, like to get that benefit, it can take a long time. It can take on average probably 6 months, but it is retroactive. So if it takes that long to get the paperwork, and say the person has already been in assisted living for those last 6 months, they'll get that money from the last 6 months that as part of the benefit to pay for the care. So, and then as far as the assisted living, yes, it's an average, and you can get it as low as $2,500, $3,000 if you're sharing a room, and that's probably boarding care home. Boarding care homes, usually people need a higher level of care. So boarding care homes are good because that includes pretty much all your care. When you go into larger assisted living communities, people tend to be a little bit more independent. So whatever it starts at, so say that the starting monthly is $4,000, and then they add on the cost of each level of care. So if somebody needs medication management, that's a flat like $500 a month. If somebody needs assistance from their room to the dining area, that might be another couple $100, just depending on how many times. So that's the tricky part about assisted living communities. The difference with memory care, which are typically a separated wing in an assisted living community, which is a locked wing. They call it a secured wings in case there's people who are wandering so they don't get out. Usually the memory care is more expensive. You add on that % of extra cost because that also typically includes all the levels of care, like the board and care home. And people refer to board and care facilities, but they're regular homes, like it's a regular house on a residential street, residential area, but they're licensed facilities.
Yeah, they tend to be more smaller, kind of private.
Yeah, and I think you mentioned average bed size is like 20 or something, but in LA and Orange County for board and care homes, average is probably closer to 6 beds in the home. It's typically like a 3 or 4 bedroom house, and each room has 2 twin beds, so they're shared rooms. So that's kind of how those board and care homes work.
Okay. Yeah, so I think depending on the area, the licensing requirements. Right.
Yeah. Yeah, because that average that you found, that's like across the nation, right?
Yes.
So
yeah.
that, I mean, it's a huge variation in different states and cities and stuff.
Yeah, depending. I mean, you can go online, and there's some websites that offer like a calculator. You input the zip code, and then then the facility that you are searching for, and it gives you the local range price.
Yeah, just don't put your information in
no.
websites, because A Place for Mom owns most of those websites. And if you enter in your information like name and address, A Place for Mom will send like referrals out to all of the local assisted living and board and care homes in your area. So if you go on those websites that A Place for Mom owns, and they you enter your info, you're suddenly their client. So then if you contact the place, they'll tell you, oh, you're A Place for Mom's client. No.
Okay.
That's how they work. So just be careful, like filling out any forms online.
Okay, good to know. Yeah, and it only asks like for the zip code. It would only ask for the zip code.
Okay, that's good.
Okay, there's no more questions or comments.
Ready to stop the recording?
Yes.
Were you able to stop it? Oh, okay. There we go. I'll stop it.